And so it's my honor to introduce our next speaker, who is Larry Arkey. Larry has been a practicing OBGYN physician for the past 22 years. Before pursuing a career in medicine, he went to Rutgers University and worked for 7 years as a mechanical engineer. He lives with his loving and supportive wife of 33 years. He has two children. His son has just started his first job as a mechanical engineer, and his daughter is in her first year of OBGYN residency. Um, Thank you so much for being here, Larry.
You're very welcome. It's a pleasure to be here. Thank you for allowing me to share my story with APBD. My name is Larry Arkey. I was formally diagnosed in April of 2023 at the age of 59. A little introduction to me, which Calliope just did. Like most people with APBD, both my parents are Ashkenazi Jews. My mother passed away in her mid-30s from a BRCA-related breast cancer. My father is in his late 80s and is healthy for his age. My paternal grandmother passed away in her 70s from what was then diagnosed as ALS. I graduated from college with a degree in mechanical engineering. I worked as an engineer for about 70 years in the field of aircraft engine design and nuclear propulsion operations with the US Navy. During these years, I began to consider going back to school for medicine. I received encouragement from an interesting oromaxillofacial surgeon who was treating my wife. I changed course. After 2 semesters of prerequisites and taking the MCATs, I was accepted to medical school. I thought I would be attracted to something mechanically oriented like orthopedic surgery. Instead, I was drawn to the field of OBGYN. I was attracted to the combination of procedures and long-term relationships I would develop with patients. People often ask me, how did you go from engineering to being an obstetrician? I would reply that responding to a pregnant woman who was hemorrhaging or a baby stuck on the way out through the birth canal is a lot like the emergencies I trained for as an engineer. I have loved delivering babies, performing surgeries, and seeing many patients over and over for the past 22 years. My background in medicine and engineering have likely influenced my diagnosis and outlook. I think I was able to recognize the difference between normal age-related changes and symptoms suggesting a problem. I pointed myself in the direction of specialists who referred me to others who helped me get a diagnosis. My background helped me realize that performing intermittent self-catheterizations would vastly simplify my life. Being in close proximity to a bathroom was controlling my life. I have started to research assistive devices such as lightweight travel scooters. I am looking at changes to my house to make it more handicap friendly. When I think about it, I had been experiencing some increasing urinary symptoms starting around 10 years ago. I attributed this to normal aging because I didn't want to think of myself as being that different from other men my age. In the spring of 2021, while COVID restrictions were still common, I drove about 4 hours from Connecticut to Pennsylvania to visit my son at college. During this trip, I needed to find an open bathroom 4 times during the 4-hour trip. This was not so easy to do at the time, as many businesses had closed their restrooms to the public. I remember my wife wondering what my problem was that I needed to stop so often. In the summer of 2021, while vacationing with my family, my wife noticed something unusual. We were hiking together, and while going downhill, instead of being out in front of her as usual, leading the way, I was hanging behind. In hindsight, I was feeling a little unsure of my footing and was holding on to placing a hand on trees alongside the path for stability. At the same time, I began to notice a tingling sensation on the tops of my feet. This was strange, but I really didn't give it too much thought. The turning point for me was experiencing 2 episodes of incontinence while sleeping. I realized I should start looking into what was happening with my body. I was so frequently bothered by my bladder that when I was working on labor and delivery, I grabbed a device called a bladder scanner. This is an ultrasound device that will tell you how much urine is left in your bladder without having to insert a catheter. It showed that just after I emptied my bladder, I still had about a half of a liter of urine left inside. No wonder I needed to void so frequently. A visit to a urologist suggested that I had a neurogenic bladder. I was also aware that I had some mild slippage of the vertebrae in my spine around the L5 S1 level, known as spondylolisthesis. So I went to see a neurosurgeon thinking that this might be the cause of my bladder issues. The neurosurgeon did not feel this was the cause of my symptoms and referred me to see a neurologist. The neurologist performed an EMG and some nerve conduction studies. I was then informed that these studies were very abnormal. Over the next few months, I had MRIs of my spine and brain, which showed some white matter lesions known as leukodystrophy and some atrophy in the brainstem. We talked about a number of conditions that could cause these findings. Routine blood testing was all normal. A lumbar puncture was then performed, and it eliminated primary progressive multiple sclerosis from the differential diagnosis. I now know that many of the findings seen on the MRI are very typical with APBD. With no clear diagnosis in mind, my neurologist offered to refer me for a second opinion. After some delay in arranging a consultation with a neurologist in Boston, I eventually went to see one at Mass General Hospital. After an examination and review of my MRI images by a neuroradiologist, I was advised to have some genetic testing. I then had the adult leukodystrophy panel performed through Invitae. I remember checking their website every few days to see when the results would be available. It took about 5 weeks for the results to become available. I then received a phone call from my neurologist who explained the diagnosis of APBD and connected me with the APBD Research Foundation. I spoke with Harriet Sachs for the first time. We talked about how APBD is a very rare disease and that research is ongoing to look for treatments or cures. In some ways, it was relief to have a firm diagnosis. At the same time, learning about the clinical course of the disease definitely brought up mixed emotions. I remember thinking about people I knew who faced the diagnosis of advanced cancers. I thought of children with similar rare diseases who would never grow up to be adults. Looking back over many years, I often now wonder, is it me or is it APBD? For example, in 2018, my wife and I were going to London and she wanted to run a 5K in Kensington Park. We did a couch to 5K training program. During the run, I needed to walk intermittently and generally had a very difficult time completing the run. Was this me or APBD? Having the urge to urinate, then regretting waiting for the next rest area while driving. Was this me or APBD? After skiing since my childhood, I suddenly developed motion sickness while skiing or when turning my head while swimming. Was this me or APBD? Very decreased tolerance to heat, me or APBD. I wonder if others can relate to my sentiment of me or APBD. Things that I or others with APBD have experienced include loss of muscular strength, fatigue, as well as problems sleeping and needing to take long naps or the sudden urge to sleep. Urinary incontinence, urgency, and a neurogenic bladder. Fecal incontinence or constipation. Changes in vision or hearing, reduced sense of smell. Dizziness or vertigo. Lack of thirst, but insatiable appetite. Throat clearing. Difficulty swallowing pills, mumbling, dictation problems or weak voice. Heat or cold intolerance or misperception of heat and hot and cold. Depression, brain fog, or difficulty with memory. Loss of normal sexual function. I wonder if anyone has ever experienced these symptoms and also thought, is it me or APBD? A piece of advice that I received from another person with APBD was, keep doing as much as you can for as long as you can. Last month, due to decreasing strength and stamina, I worked my final shift delivering babies. I then went on vacation, and with the help of an e-bike, I was able to enjoy 6 days touring around Nova Scotia. It was much easier for me to ride 30 miles in a day on an e-bike than to walk 1 mile with walking sticks. Before my diagnosis with APBD, I envisioned certain things about my future. I plan to keep on practicing obstetrics until around age 65. I imagined a lot of walking and hiking for both pleasure and while on vacation. These plans will need to change. I have read a number of articles on APBD and watched some of the videos on the APBD Facebook page. I still have many questions. Do we have an opinion from a biochemist or someone with expertise in carbohydrate metabolism about dietary recommendations? What are the greatest challenges to getting a possible therapy into the hands of people with APBD? If a trial is not realistic, is some sort of compassionate use possible? Does the degree of physical activity affect the progression of the disease? Is more than a little amount of exercise, of exertion, not really a good thing for us? Maybe this or future scientific research and sessions will help answer some of these questions. I want to end with a brief quote. Many of you may know of Michael J. Fox. He's a Canadian-born actor who was diagnosed about 30-something years ago now with Parkinson's disease. And I was reading an article about him after my diagnosis. And one of the quotes from him was, "With gratitude, optimism is sustainable." So I want to say that I am grateful for all the help of my family and friends, and grateful for all the researchers who were participating in these ongoing work to try to find a cure for APBD and other rare diseases. Thank you very much.